Bob Vogel. I'm a restorative dentist in Palm Beach Gardens, Florida. Been in practice for 28 years, and about the past 15 years my practice has been primarily focused on implant prosthetics. When I select an implant system for my patients and for my practice, certainly I want a system that is comprehensive, that has prosthetic flexibility, but more importantly that has research behind it, that has literature behind it, something that's been around 30, 40 years, and something that's going to be around for a while, not only so that I know I have the support that I need for components down the road, but also to know that there's a track record with the company. And certainly I chose Straumann as my system in my practice for my patients based on their track record in the literature, in the research, and knowing that it's a stable system that also has full prosthetic flexibility, so I can stay within the system, which is a very important factor to me. When I'm providing a service for the patient, they've gone through implant surgery, and I certainly wouldn't compromise on the prosthetics that I put on top of that for many reasons. Number one, I want to make sure that the prosthetics are stable. We've gone through, anybody that's been in implant dentistry long enough is familiar with broken screws and loose screws, and while that's not necessarily a catastrophic failure of the implant, certainly prosthetically that's devastating, not only in terms of patient trust or patient care, but what it does to the practice in terms of profitability of the practice, and that's secondary to patient care, but having to replace components or replace prosthetics. So if we're making the decision to go with a top quality implant, which certainly that's what I want for my patients, there's no sense in compromising the prosthetics that go on top of that. One of the problems, and certainly lookalikes look alike, but I don't know if they have the machining tolerances of staying specific to a company, staying true to a system. Certainly those components I know are manufactured to the tolerances that the implant was manufactured. And they have the research and development behind them, they have the testing behind them that I don't have to worry about. How it affects my practice in terms of productivity or profitability is I go home at the end of the day knowing that things are stable, things aren't going to break. And I think if we look at the literature, and I'm a bit of a literature geek, but if we look at the literature, we see now emerging the consequences of dissimilar metals, meaning if we're mixing different metals together, we don't know yet the long-term consequence that will have on the soft tissue, possible patient allergies. Are we going to see different rates of wear and micro motion and loosening of the components, which from a practice management standpoint compromises the prosthetics that I'm responsible for, but also compromises my patient's health in terms of what are these components made of, and are they matched ideally to the material of the implant. I made a choice years ago, many years ago, I made a choice of implant systems for my patients, and for my practice obviously, but for my patients, and that was the Straumann system based on the literature, the long-term literature that's available, knowing that there's a track record. But in terms of why I stay with authentic components, if I'm choosing a system, I'm choosing a complete system, and Straumann offers that, a complete system. So certainly I want to stay with authentic components that are manufactured with the machining tolerances that the implants are known for, that are made of materials that are 100% compatible with the material of the implant, and also the security of knowing that if there was a problem, I haven't had a problem, but if there was a problem, I have a company with a 60-year history and a local representative that I can call and say, hey, what's going on? But also after viewing the manufacturing of implant components, I came away with a much greater understanding of why authentic components are so critical in not just the manufacturing on massive machine, multi-million-dollar machines, which certainly my local lab couldn't do, but the level of quality control. When you see the level of quality control that's put into these components, then you know that you're not a test site on this, that you're getting something that's really going to be there for years. When we look at the team approach to implant dentistry, and as a restorative dentist, and I'm not placing implants, as a restorative dentist, I rely significantly on my team members, my surgeon and my lab. But ultimately, what it all comes down to is me. If the patient has a problem, it's not a surgical problem that happens 5-10 years down the road. It's a prosthetic problem, and I need to make sure that my surgeon's not compromising on the foundation upon which I build my prosthetics. I need to make sure that my laboratory isn't in any means compromising, and they might not even be aware of it, but to make sure that I'm aware of what I'm getting from the laboratory, because at the end of the day, if there is a prosthetic complication, it's me they're coming to, and I need to make sure that both my surgeon and my lab are on board with me, supporting me. When we look at the complications or potential consequences of using components that are not original to the system, I don't know if we can come up with a specific answer because we don't know much about those components. We don't know, when I look at the literature and I look at research that's been done, that's done on an implant system and that implant system's components. And I know how that system, in my case, I'm a Straumann user, and I look at an article that's written and Straumann components are used on there. I know what I'm getting, I know what I'm going to expect. There's a large unknown when you start going into the use of look-alike or clone, whatever, other companies' components on there. We just don't know. They might be perfect. We don't know. But also, what it comes down to is, are the metals exactly the same? Are the manufacturing tolerances exactly the same? And if they're not, then I'm just leaving my patients at too great a risk, and leaving my practice at too great a risk for complications. As a restorative dentist, I speak with my lab every day, 3 times a day. I deal with my lab on every case, and it's so critical that I know that everything is seamless, from my impression coping, my analog, my final abutment, that there is no compromise, there is no unknowns going on. So it's critical that my laboratory is using authentic components that match my impression components, my analogs, and the implant that the patient has, to not only minimize potential complications or minimize potential risk. When we talk about identifying components or original components and being a Straumann user, I've sort of gotten to a point where I get a little happy feeling when I open up an abutment. I see the little Straumann logo on there, and when I look at I know where to look. The connection where it goes inside the implant. And you do see the little Straumann, the little black flag on there, the little Straumann logo, and it's a good feeling. The question of seating abutments and the tactile sensation, and as any restorative dentist, and I'm sure many surgeons know, there is a very definitive tactile sensation when you place an abutment and an implant. The interesting thing about the Straumann system, and out of necessity, I do restore other systems on a daily basis. Patient will come in with another system. The beauty of the Straumann, the feedback, the tactile feedback that you get with that system is that a couple of factors. One, I know, and my assistants appreciate this possibly more than I, that when I go to seat an abutment, that screw won't tighten down unless the abutment is exactly in the right position. And there's no binding, you're not feeling a false sense of torque. When that abutment goes down and you place a torque control device on there, there's a very definite feel that that's a Straumann component. The nature of my practice is such that I get a lot of implant complications referred to me, and prosthetic complications referred to me, and quite often I'm disassembling a case, or I might be drilling out a broken screw or drilling through a crown to get to a loose abutment. And I'll tell you that the amount of time and energy and frustration spent on trying to sort of resurrect a case or salvage a case, it might be the equivalent of 10 cases that just go smooth and go easy. Placing an abutment in my practice is a 30-second process. on a slow day. Taking an impression, placing an impression component is maybe a 30-second process. Retrieving a broken component or disassembling a case to remove a broken screw, that's a big unknown. We have to block out a minimum of a 2-hour slot, and there's no way you can be compensated by the patient for that amount of time. Plus, once you get in there, the question is, do you have the right components to resurrect that case? You can't send a patient home with a hole there. You're going to do something. I know that with original components, authentic components, that I know what I'm going to find. And if there was a complication, there's no question. I have another screw sitting there ready to go in. You know, when today's dentistry, implant dentistry, is not like it was 10, 15 years ago. Today, the laboratory and the surgeon are very much involved with each other. Sometimes I feel like I'm kind of in the middle of the whole process because my laboratory and my surgeon are having conversations about the cases that I'm not aware of. But it's so critical that the surgeon has the tools to speak to the lab, and the lab has the tools to speak to the surgeon. And what I mean by that is working with a system or a company like the Straumann company that provides the total solution, not only the implants, obviously, but now we're doing more guided surgery to have the software that the surgeon can scan something and send that to the lab. And the lab can open that up and design, and I'm a big proponent, probably 90% of what I do today is CAD/CAM abutments, literally 90% is CAD/CAM abutments. My laboratory needs to be able to design that abutment. Of course, there are other options, such as scan and shape, where the lab can have Straumann design it for them. But I want my laboratory to have the software that speaks to Straumann, it speaks to the surgeon, and I could sit down at my computer in middle of the day and I could see how a case is going and know that all that is happening very seamless. And not only is it seamless because the company has a total solution of surgically, restorative, and laboratory-wise, but also to know that it's being maintained at a high level of precision. We're not going from one file to another file and switching systems in between where there could be complications.